A patient presented with extension of MCP joint and flexion of the IP joint. Which muscle is affected? A. Interosseous and lumbricals. B. Extensor digitorum. C. Abductor pollicis longus. D. Abductor pollicis brevis. So the patient presented with extension of MCP joint and flexion of IP joint. So which muscle is affected? Let us see what the answer is. The correct answer is interosseous and lumbricals. So a patient presented with extension of MCP joint and flexion of IP joint. Which muscle is affected? It is interosseous and lumbricals. So extension of MCP joint and flexion of IP joint is due to the palsy of lumbricals and interosseous muscles. Ligation of common hepatic artery will impair blood supply in A. Right gastric and left gastric artery. B. Right gastric and right gastroepiploic artery. C. Right gastroepiploic and short gastric vessels. D. Right gastric and short gastric vessels. Ligation of common hepatic artery will impair blood supply in The correct option here is right gastric and right gastroepiploic artery. So right gastric artery is a relatively small artery that usually arises from the common hepatic artery. This right gastric artery runs to the pylorus and then along the lesser curvature of stomach. It anastomoses with the left gastric artery. So this right gastric artery is a relatively small artery. It arises from the common hepatic artery, runs to the pylorus and then along the lesser curvature of stomach and then anastomoses with the left gastric artery. Now coming to right gastroepiploic artery. The right gastroepiploic artery usually originates from the gastroduodenal artery. So right gastroepiploic artery originates from the gastroduodenal artery, where behind the first part of duodenum, which is a branch of common hepatic artery. It is also called gastroomental artery. It runs to the left along the greater curvature of stomach. It runs along the greater curvature of stomach, supplying the stomach and greater omentum. Now, this question is very important. Tumor of uncinate process of pancreas affects which of the following vessel? A. Superior mesenteric. B. Portal vein. C. Common hepatic artery. D. Inferior mesenteric artery. The correct option here is superior mesenteric artery. The uncinate process of pancreas is a projection of lower part of the head to the left behind the superior mesenteric vessels. Now this superior mesenteric artery arises from the aorta, approximately 1 to 2 cm below the celiac trunk at the level of L1 vertebral body. This descends across the uncinate process of pancreas and third part of duodenum and then enters the root of mesentery behind the transverse colon to run to the right iliac fossa. The portal vein runs behind the neck of pancreas. The inferior mesenteric artery passes to the left behind the peritoneum and distributes to the descending and sigmoid colon and the upper portion of rectum. So this uncinate process of pancreas is a projection of lower part of head to the left behind the superior mesenteric vessels. So superior mesenteric artery obstruction can be caused by a thrombus or an embolus or atherosclerosis or an aortic aneurysm or a tumor in uncinate process of pancreas, compression by the third part of duodenum, or a surgical scar tissue. This obstruction leads to small and large intestinal ischemia resulting in necrosis of all or part of inward intestinal segment. The symptoms are abdominal pain, nausea, vomiting, diarrhea, and electrolyte imbalance. Fourth question. A man was brought to emergency after meeting with an accident and injured the perineum. He gets an urge to micturate. But is unable to pass the urine. On examination, blood was seen at the tip of urethra and swelling of penis and scrotum. This is because of A. Penile urethra rupture, B. Bulbar urethra rupture, C. Membranous urethra rupture, and D. Urinary bladder rupture. Bulbar urethral rupture. Bulbar urethra, which is surrounded by bulbospongiosis and entirely within the perineum, and a pendulous or penile component, continues to the tip of penis. Extravasated urine may result from rupture of bulbous portion of spongy urethra below the urogenital diaphragm. The urine may pass into superficial perineal space and spread inferiorly into scrotum, anteriorly around the penis, and superiorly into the lower part of abdominal wall. Now, rupture of bulbar urethra leads to extravasation of urine in the penis, scrotum, superficial perineal pouch, and anterior abdominal wall. The urine cannot spread laterally into thigh because the inferior fascia of the urogenital diaphragm and the superficial fascia of perineum are firmly attached to the ischiopubic rami and are connected with deep fascia of the thigh. It cannot spread posteriorly to anal region because the perineal membrane and coalesced fascia are continuous with each other around the superficial transverse perineal muscles. If the posterior urethra is injured, urine is extravasated into the pelvic extraperitoneal tissue. If the membranous part of urethra is ruptured, urine escapes into the deep perineal space and can extravasate upward around the prostate and bladder or downward into the superficial perineal space. A woman with 18 weeks gestation presented to the OPD. On abdominal examination, the uterine size was 16 weeks. On ultrasonography, oligohydramnios was found. Which of the following is suspected? A. Fetal anemia, B. Tracheoesophageal fistula, C. Renal agenesis, and D. Anencephaly. The correct option is renal agenesis. Now, oligohydramnios due to renal agenesis and ureteric atresia. What is oligohydramnios? Low level of amniotic fluid, that is less than 400 ml, It may be associated with the inability of fetus to excrete urine into amniotic sac due to renal agenesis. This results in many fetal deformities. For example, Potter syndrome. Potter syndrome is deformed limbs, wrinkly skin, abnormal facial appearance, and hypoplastic lungs due to increased pressure on the fetal thorax. Now, renal agenesis occurs when the ureteric bud fails to develop, thereby eliminating the induction of metanephric muscles and nephron formation. Now, unilateral renal agenesis occurs more commonly in males. Unilateral renal agenesis is asymptomatic and is compatible with life because the remaining kidney hypertrophies. Now, bilateral renal agenesis is relatively uncommon. The infants are usually stillborn or die shortly after birth. Now coming to polyhydramnios. Polyhydramnios is the high amount of amniotic fluid, that is 2000 ml in the late pregnancy. It is associated with the inability of fetus to swallow due to tracheoesophageal fistula, esophageal atresia or anencephaly.